Good afternoon, everyone. My name is Lucy Biddle, so I'm from University of Bristol. And I'd like to start by thanking Emerging Minds for supporting our work and giving us a chance to talk about it today. So this project is a collaboration between University of Bristol and Samaritans, UK's leading suicide prevention charity. And it examines the step-by-step service which Samaritans provides to schools in England and Wales following the suicide of a student. So step-by-step works with schools during a time of crisis and turmoil and helps them to recover. So as a bit of background, each year approximately 150 school children die by suicide in England and Wales, leaving behind very devastated but also very vulnerable communities. So we know that the suicide of a young person often has long-term effects on the mental health of their peers, and particularly where this occurs within an institution like a school, there's an elevated risk that these effects may extend to further suicidal behaviour due to the phenomenon of suicidal contagion and clustering. So prompted in part by case studies of this kind of clustering, the need for post-prevention support in schools is recognised in the scientific literature, in policy documents and by teachers. But despite that, school post-prevention services and also the evidence base for these is extremely limited, as is that about general interventions for responding to clustering. So we're uncertain about what the key components are of an effective intervention, though we do know that inappropriately designed post-prevention can actually contribute to contagion. So before I talk about the specific objectives for this study, I want to hand over to Carol from Samaritans, who's going to give you a brief description of the step-by-step intervention. Over to you, Carol.
Good afternoon. My name is Carol Jordan. I'm the Functional Lead for Education within Samaritans and oversee the step-by-step service. I'll just give you a little bit of overview about the step-by-step service. It's been running in the United Kingdom since 2010, and we started the service really because we felt there was a gap and a need. A couple of years ago, we also started working with universities as well as schools and colleges. But the whole aims of our service is really to reach out to those higher risk communities and to reduce further suicides, as Lucy said, because we recognise that by assisting school communities to handle situations sensitively and responsibly within the normal, that it helps them to recover quicker and to get back to normal quicker. It also has a significant impact on reducing the risk of contagion. There's been quite a lot of research done about that, particularly in Canada, where to have a good response as quickly does reduce that risk of contagion. Okay, well, as I'm sure you're all aware, people have described to us like, when you get that news, it's just echoes everywhere. One death can have a significant impact on so many people. And one of the things that schools and colleges and universities find, it's that, how do you, when you get that terrible news in that first thing in the morning, what do you first do? The most confident people again start to fall back on, well, what do we do? So we do encourage establishments to have a post-prevention plan that actually not only is a critical incident plan for everything, but also covers suicide, because then they can very quickly pick it up and action it. And one of the key things that we find we're asked to do at the beginning is just to be there on the phone or to send that information through as to what, just do that calming voice really, and somebody to talk to. Okay. So what does step-by-step offer? We work in partnership with our local branches. Step-by-step post-prevention advisors have been specially trained so they can respond to and help following suicide or a suspected suicide. We are the only service within Samaritans that actually can give advice, and that advice can be practical advice about how to respond and support or work with the media. often it'll be the local branch that may go in and take some initial leaflets. We have a booklet called Help When We Needed It Most that we'd always email over quickly, and then we'd offer telephone support and face-to-face usually, if the school or the college feel it will be beneficial. Okay. So I think I've just, access to Samaritans, that for the organisation that's gathering the support at the time, it would be the post-vention advisors, but we would also give out information about how they can access other services within Samaritans for support. And we do work with and support the leadership team, because we feel that giving our evidence has shown by giving them confidence and enabling them to feel more back in control, then they're the best people to support their students. We would offer advice and support to them and to the teachers and to parents. Okay, those are some of the things that we can offer at this time. We have a brilliant press office at Samaritans who are always prepared to help with press inquiries, and we have an excellent booklet that actually just talks the organisation through those things. It's called Help When We Needed It Most, and that would be one of the first things we would actually email out to the school or the college to enable them to start to plan themselves what they need to do. Okay.
Back to me now. So as Carol sort of indicated, Step by Step is unique. It's possibly the only established school post-vention service in the UK, and it also has this potential to improve young people's mental health and reduce suicide risk. So our overall ambition, if you like, is to carry out a full-scale evaluation. But I think, as Carol's already indicated, Step by Step is complex, which presents us with some methodological challenges. So it's tailored, it's delivered at different levels of intensity through different forums, maybe face-to-face, maybe over the phone, with varying components that get picked from essentially a buffet of possibilities. And what the intervention looks like in each case emerges from a process of interaction between the post-vention advisor and the school. So to evaluate, we need to be able to pin this down, and so a specific aim of this project is to identify how we can define and how we can measure the step-by-step intervention in such a way that we can then go on to evaluate it. So to this end, we've got these three objectives. So the first two will involve us co-developing tools to systematically record what is delivered at each school, and then to classify that according to the level of intensity, or the dose, if you like, of step-by-step that's received, in a meaningful way that will take account of both the types of components that are there and also the mode of delivery. And then third, we want to identify or to understand more about the process by which intervention delivery is decided in each school, how that works in practice, particularly from the school's perspective, and how acceptable that is. So we're going to address these over two phases of research. So the first phase, we'll be developing our tools through an iterative process. So this will begin with a series of meetings between university researchers and key Samaritan staff, and also a focus group with a varied group of the post-vention advisors who deliver step-by-step at ground level. And we'll be using both the meetings and the focus group to gather some quite detailed information about step-by-step, including ideas about what the key components are and the varying ways in which they're delivered, and also views about what does constitute high, medium or low use. And then analysis of that information will help us develop some proposals for a data capture tool, and also a framework for categorising level of intervention or dose, which will then become the focus of our discussion in a second meeting and a second focus group with the post-vention advisors. So we'll refine our tools again further as a result of that second round, and end the phase with a co-created means of capturing and classifying data about intervention delivery. And then moving on to the second phase, this is a pilot phase with three main activities. So first, the postvention advisors will be asked to pilot our new tools with all the contacts that they have during an 8-month period, which is likely to be around about 80 contacts. And then alongside that, we'll be conducting qualitative interviews with a key staff member from 10 of the schools who receive Step by Step, focusing here particularly on this process of deciding how Step by Step is going to be delivered, what components are going to be in the package for that school, whether that included all the things the school perhaps might have wanted it to include, and whether they agree with the way that we're classifying their level of input. And then thirdly, we'll close with a workshop attended by the PVAs and various school staff and academics to feedback on our findings and gather some final reflections and refinements to our tools, so we end up with something that's accurate and acceptable. And then just finally, I wanted to mention some of our impacts that we anticipate. So these are immediate and long term really, stemming from this work. So first, there will be some immediate learning and service gains for Samaritans, such as gaining insights into a school perspective, especially on this intervention tailoring, also improved understanding around the key components of the service and efficiency about recording where these are offered. So that presents them with an opportunity, I think, to offer a more clearly defined service. In the longer term, crucially, the work will enable us to progress to full-scale intervention, evaluation of the intervention, which in turn will help Samaritans refine the service for greatest effect and help them with this wish to roll this out to other settings, including universities, as Carol mentioned. And then finally, I think our work has some broader academic contribution to make to that evidence gap that I mentioned at the beginning around how to actually respond to suicide clusters, how to deliver good suicide postvention, and what the key components of that might be. So thanks for listening to the brief summary of our work, and we'll do our best to respond to any questions in the chat.